Dr. Chalwa, I have one more question for you. We had received a lot of questions in regards to foods. What foods are going to be beneficial to help manage pain or that possibly increase joint pain? In addition, I want to tack on another question in regards to alcohol. And does that also increase and play a role in pain?
Sure, great question. I think from my perspective as a rheumatologist, again, it really goes down to the evidence of that particular food or beverage within the scope of which classification of arthritis. I think we have different data points within different types of arthritis. So if we focus on a type of autoimmune arthritis like gout, we certainly know foods that are high in purines. So these are red meats, shellfish, shrimp, high fructose corn syrup, soda, alcohol, particularly beer with high barley content, has certainly been implicated to cause gout flares and further exacerbate joint destruction. If we're talking about rheumatoid arthritis, 1% of the population with the bilateral symmetric inflammatory arthritis, the data really supports omega-3 fatty acids and vitamin D. There was a study that was recently presented at our American College of Rheumatology meeting that supports vitamin D and omega-3 fatty acids in long-term to maybe even help prevent some of our autoimmune diseases from manifesting. In osteoarthritis or wear and tear arthritis, which I touched on earlier today, which is the degenerative joint disease that we all kind of get at some point, there really hasn't been any robust evidence that supports one sort of dietary practice over another. But in clinical practice, I have heard this so many times from my patients that I have to share it. You know, a lot of my patients will sometimes say, you know, I've cut down some of the complex carbohydrates, or I have increased my water intake. Some of my patients, they don't have celiac disease, but they may have some sort of slight gluten intolerance or insensitivity where they may have decreased their gluten intake, or they may have, in some cases, even gone vegetarian or vegan. And not that I'm formally endorsing that, but I've just heard it so many times from my patients that I think it has possibly a role in managing their overall well-being.